Hello, Gold participants from around the world. I'm Fleur Bickford, Program Director and MC for Gold Learning. I'm chatting today with Carolyn Lund about her upcoming presentation titled Evidence-Based Neonatal Skin Care, Bathing, Disinfectants, Medical Adhesives, and Diaper Dermatitis. So Carolyn, welcome. We are happy to have you with us for the Gold Neonatal Conference. Okay, so we're going to jump into a few interview questions here. First question I have for you, Carolyn, is just what led to your interest in neonatal skincare and why do you feel it's so important?
Well, welcome participants. It's an honor to be able to speak to you soon about this topic that's been incredibly important to me throughout my career as a neonatal nurse. What really led to my interest in neonatal skincare was at the very beginning of my career, we started to see smaller and smaller premature infants able to survive because of other technologies. And yet we as nurses noticed that they were having big problems with maintaining skin integrity. It seemed that a lot of the caregiving that we provided caused real problems and skin breakdown, infections, and other problems for our patients. And so we gathered together just here at our hospital and decided to try to not only come up with ways to treat the skin breakdown, but also to find better ways to care for the baby's skin and try to prevent skin breakdown. Well, that in turn led to our looking to the literature to see what was available scientifically, both in research and in textbooks. And although there was some information, and some of which I'm going to share with you during the seminar, it was still a lot of lacking research areas. So we started to do some studies on our own. We looked at medical adhesives, for example. We looked at skin maturation and later at bathing practices and published this research. Well, at that point, a lot of neonatal nurses became interested in skin care. And I was then asked to lead the science team in authoring an evidence-based neonatal skincare guideline. This effort was sponsored by both the Association of Women's Health Obstetrics and Neonatal Nurses, AWON, and the National Association of Neonatal Nurses, NAN. And what it consisted of actually was a science team gathering as much research as possible, critiquing the research, writing the evidence-based guideline. And then we later evaluated, was it beneficial to use the guideline? And 51 nurseries participated in that project. The guideline has really stuck around. Now it's sponsored solely by A1, and it's been revised both in 2007, 2013, and 2018. And I've been honored to be a participant in all of the work with evidence-based care.
Oh, well, Carolyn, thank you so much for sharing that. That is fascinating. So another question for you is just about what do you hope delegates will take away from your presentation and be able to take back to their own practices?
Well, it'll be interesting to see who the delegates are because now a lot of neonatal nurses have become their own experts, developed real skills and knowledge about neonatal skincare. There might be other people, though, who are somewhat new to this topic. And so I hope to be able to meet the needs of both groups. Really, there's two aims of my work. One is to raise the level of knowledge of neonatal skin, what's unique about it, what's different, as well as looking at skincare practices, the nursing care for neonatal skin, and try to support with evidence the best practices to prevent skin integrity problems in our patients. In addition, we will be looking in some detail at some of the research that we reviewed because I think it's helpful for nurses to learn how to critique a study, how to look at a study and see what's really helpful or supportive evidence. So there's really two goals to the seminar that you'll be hearing.
Okay, thank you so much, and really looking forward to hearing more from you during your presentation. And for all of our delegates who are listening, Carolyn will be presenting live on Tuesday, June the 12th, so we look forward to seeing you then. Bye for now, everyone.